I'm Judith Brown and I'm one of the Shine team as well, working with Dawn. And I'm delighted to welcome Andy Dingwall this morning to our first breakout parallel session. Andy is Deputy Head Teacher at Bargary High School and currently seconded to Tayside Collaborative as Coordinator of the School Counselling service there. We've done a lot of work with Andy, which has been absolutely great, and you're going to hear a lot of the wonderful work at Bargary this morning, both in this session and a session later on. So I think, Andy, do you want to start sharing your slides? And then this session, we'll have, I think you'll speak for about 10 minutes, if that's okay. And then if I'll give you a 2-minute warning, if that's okay too, I'll just say 2 minutes if so that you know, and then we'll have some questions at the end.
Great.
Brilliant.
Okay.
I think we'll just start, and then let's see. I think what I'll do is I'll put my camera off and mute myself, and then we'll go. Okay. Thanks.
Okay, thanks, Judith. I'll just make a start to try and get through quite a lot in a short space of time. So I'll just set the scene. So our context in Blairgowrie is that we're technically rural, although it is the second largest town in Perth and Kinross. The catchment includes 10 primaries, varying from larger town-based schools through to small and rural schools. And it is the single secondary school in the area. So it's classically comprehensive. We've got families from SIND 1 to 10, just under 800 pupils, and the full spectrum of needs is represented. So that's where we are. The aim of this case study is to talk about how health and wellbeing data impacts on the PSE curriculum to make sure it's relevant and reflects the needs of the community. But I need to set the context of that in what's been a wider health and wellbeing planning journey. So about 3 years ago, January 2018, we opted to review health and wellbeing delivery as a school. We began by using the Education Scotland resource, Making the Links, Making It Work. And at an early stage, we realised that while we could create a school vision and plan, we were much more likely to have an impact if we worked across our cluster to create a more progressive and consistent way forward for health and wellbeing that also involved wider partners in the community to make sure everybody could be involved in making an impact. So in May 2018, we undertook a wide-ranging survey that covered primary and secondary learners, as well as parents and carers. And questions were asked covering everything from how children rated themselves within the wellbeing indicators through to how many glasses of water they drank each day. And in June 2018, a cross-sector strategic working group was set up to consider the results. The group drew on wider research as well as their own local knowledge and expertise to create a strategy to try and improve health and wellbeing around the priorities emerging from our strategy. We launched our strategy at a learning festival in February 2019, and that involved staff from across our cluster schools, a range of partner agencies, and some other people as well. And the plan that we come up with in this strategy was tied into our Perth and Kinross Council Health and Wellbeing Strategy and also the Tayside Plan, which means that we're confident that we're addressing national, local authority and local community priorities in everything that we do. It's also important to point out that the research we did tried to capture what children and young people felt were the most important wellbeing issues for them and what they wanted to learn more about. So the strategy sets out 4 priorities: mental wellbeing and resilience, sleep, physical health and diet, and communication and engagement. The first priority is around mental wellbeing and resilience. So we know that prevention and early intervention are key to supporting positive mental health. And Perth and Kinross compares quite favourably to national averages regarding many aspects of mental wellbeing. But nationally, we know that the numbers are growing of young people presenting with a range of mental wellbeing issues, with at least 1 in 10, 5 to 16-year-olds presenting with a mental health problem. Our local survey matched national trends regarding young people rating themselves less positively in areas of wellbeing as they progress through school and their teenage years. In particular, we noted that there was a significant dip in some areas at S3, and the respected indicator rated poorly in comparison to others. This linked closely to our SHINE data that we received in our 2018 report regarding mental health and wellbeing. we saw in that our learners appear to experience higher stress levels than was average for our regional area. And our health and wellbeing survey that we carried out indicated a clear desire by our young people to learn more about stress control. So as a result, resilience education and managing emotions became part of our improvement plan. Feeling left out was also highlighted as an area in the SHINE report as something we needed to think about, and that matched the relatively lower rating of the included wellbeing indicator in our own survey. So our improvement plan included, as a number one priority, a whole school focus on respect and resilience. We know that positive mental health can be described as being able to cope and engage in everyday life and cope and recover from illness and challenge. And promoting positive emotions and well-being can decrease distress and anxiety. Resilience can be defined as being able to effectively deal with and recover from stressful experience and challenge. So we know that improving resilience will help our children, young people and families in improving mental well-being for everyone. So our action plan for this area focused on a range of resources and strategies to improve resilience, respect and positive mentality. And that had a significant impact on our PSE planning. We worked with our educational psychology team to develop and implement a pilot of secondary school Bounce Back. Bounce Back is a resilience education programme that had previously been implemented across the primary sector in Perth and Kinross. And that's involved us reworking our S1 curriculum to include the first 4 units of Bounce Back, utilising it to tie into already existing PSE content. And that development's been taken forward in partnership with the PE department. While the concept learning and the main activities have taken place in PSE, PE worked on using the language of Bounce Back and incorporating it into their coaching approaches conversations with learners. All of our S1 undertook the Warwick Edinburgh Mental Wellbeing Scale fairly early in the year, and the plan was to redo that towards the end of S1. Unfortunately, a pandemic kicked in, but the learning has taken place, and now the next 4 units are being looked at for introduction into S2, and we'll think about baseline measurements as we go forward. So if you're a SHINE school, you'll be aware of the suggested strategies and actions that are contained in the report you receive, and we use these to help with our evaluation and planning. The other element of the mental wellbeing strand of the strategy that's impacted on PSE has been the link to rights education. As a school, we're seeking our silver level accreditation as a rights respecting school. So all departments have developed their planning to deliver learning around rights and have mapped UNCRC articles to key aspects of learning. The second priority in the strategy focused on sleep. We know that sleep is fundamental to health and well-being. We know that children don't learn well if they're tired, and that lack of sleep in children and young people fundamentally impairs learning and contributes to inactivity, obesity, depression, and a range of other health conditions, including reduced resilience. So our local survey demonstrated that just over 1 in 5 primary age children were not getting enough sleep, and that rose to nearly 40% on average for secondary age young people, 4 in every 10 learners, and it worsened as they moved through school. We carried out more research with the Sleepy Teens project, which gave similar results, and although our SHINE data demonstrated that the sample group were getting around 8 hours sleep, we were below the mean for our Regional Improvement Collaborative. So our sleep action plan included a range of strategies and actions to introduce sleep programs and to train staff. The suggested actions in the SHINE report were helpful for implementation, and from working with these, we've had a member of our staff who spent a year learning and researching around sleep education. She's undertaken Sleep Scotland training and has been part of an improvement collaborative project with the Children's and Young People's Improvement Collaborative, looking at the effects of sleep on education and engagement. I know that there's a Scram session coming up today, and we've been part of that. We partnered with Scrams and held a Sleep Awareness Week and have introduced a Sleep Champions programme. Now the planning for that is to run sleep education as a whole school event, but then to embed it into the PSE programme so that year on year we'll be able to build on the key messages around sleep and ensure that they are introduced to children and young people at the right time at the key stages for them. The third priority in our strategy was around physical health and diet, and the fourth was around communicating the key messages and engaging the community with health and well-being. These haven't really been the focus for PSE until now. However, this year we're aiming to deliver the SQA Health and Wellbeing Award for all learners through PSE in S4. So there's a development there that will include a focus on individual health and wellbeing and reflecting on how young people can support the health and wellbeing of others. So it ties right into our priorities. So the development of that PSE programme, where we're trying to make a real impact around health and wellbeing in each year group, has come from an in-house survey that was then validated through some of the data from the SHINE report alongside other research, and has been developed in a partnership approach with our primaries and with a range of other partners through our health and wellbeing strategic group. So we're confident that we now have comparable, useful data that we can use to drive improvement of our curriculum. And the next step...
Yeah, about 2 minutes. Is that okay? Thanks.
That's fine, yeah. I was just going to say the next steps really for us, we've done a lot of development work over the last couple of years with this. And it's really beginning to have an impact now, and it'll be interesting to see the measurement over the next little while as all of this comes into place. But really the next steps for us are thinking about how we evaluate that in more detail, and also how we can involve young people more in looking at the data and helping decide what else they think is important for them and reflecting on that. And that's me.
Oh, that's great, Andy. Thanks so much for that. And Andy's been great. He's come out with us to a few conferences as well and presented this work, which has been really great to show the work that he's been doing and also the work that Shine's been able to support with. I think we better move on to that. We've already got 2 questions in the Q&A box. If anyone else would like to type anything in, please fire away. And again, if we can't answer them, we'll copy them and Dawn will get back to you after the conference. But Andy, can you see the questions too? So I'll just read them out, but there's one from David saying, "Hi Andy, this is all very interesting. Thank you for sharing. Have you modified the original bounce back materials to suit the older age group? Would you be willing to share this if so?"
Yeah, sure. So I need to give credit here to one of the guidance staff in particular, one of our principal teachers, Andy McNiven. He took the original materials and had a look at them alongside what we were already doing in S1, so some of the key topics we'd be covering and outcomes we were trying to meet anyway. And what he's tried to do is merge them together a bit. So where we were already doing a bit of work around peer relationships, he's tried to take the key themes from Bounce Back and build those into those sessions, or where we were maybe looking at peer mentoring, those kinds of things. So yeah, I'm sure Andy would be happy to share, so I can put people in touch with him if they contact me.
Yeah, that'd be great. We can help with that. So Emma says, what tool did you use to carry out your surveys?
Okay, so it was a pretty basic format in that we had a look at several areas we thought were relevant, and we came up with our own questions, but we looked at some of the health behaviour questions and the things that we used in other surveys and adapted those, and then we looked at the wellbeing indicators and really just asked questions around how far did people rate themselves on a scale within each of the wellbeing indicators. Again, it was quite a big survey. There was a lot of questions in there, but relatively basic. But again, happy to share that with anybody who wants to use those. Yeah,
that's great. And Emma, the next presentation might be helpful for you as well when we talk about the SHINE survey. So Leanne has asked, can we get access to the PowerPoint, please? I think, Andy, the recordings are going to be available. I think if presenters agrees, the PowerPoints will be available too. Yeah.
Yeah, that's fine.
Hi, David. On sleep, what impact does travel to school in your rural setting impact upon this? And also any info on how sleep has been affected under lockdown homeschooling?
Okay, so that's interesting actually. We haven't looked at the impact on travel. Inevitably there's going to be something in there around young people who are having to get on buses pretty early in the morning and get down to school. So we haven't looked at it in detail though, so that's an interesting one. And in terms of lockdown, that's very much going to be part of the focus when the whole school sleep development takes place this session. We'll be looking at you know, what has happened there. We're very aware of, as I'm sure all schools are, some young people who really struggled with the change in their systems and the times they were getting up and not going to sleep, etc. So I'm sure that will have a big impact.
Yeah, and that question came from David, and we'll be hearing from David. David's speaking this afternoon on the results from the Teen COVID Life study. So there'll be some, David will be presenting some sleep results there too. So all this time together, yeah. Okay, so Florence, oh, lots of questions. I'll try and move through them quickly, a few more minutes. Are there plans to review the initial findings given the impact of COVID-19?
Yeah, so the plan for our strategy was that we launched in 2019. We were going to have, the plan was always to have a kind of midway review in 2021, and then a final review towards 2023, end of 2023, with a view to making development plans for going forward. So yeah, absolutely there'll be a review of what we found, and a bit of a stock take takes place over the next little while.
Okay, a question from Janine. Have you considered doing the same thing for the compassionate and connected classroom resources, adapting them for the older pupils?
Yeah, so that's interesting. We've had a look at it now that we've got the bounce back materials in and kind of adapted to suit our context. We've actually been talking about, or we had been talking about, what else we could do that with and where else we could pick up on things that are looking really useful. And those are really useful resources. So I'm sure that will become part of the plan. That's really helpful.
Okay. And one last question from Pam Steele. Was your survey anonymous? If not, how did you tackle specific concerns about pupils?
Okay, so yeah, we didn't make the survey anonymous. For secondary pupils, they did put their names on, or they had the option to put their names on. There was an option to complete it anonymously, but most put their names in. And there were one or two answers in there that did need a little bit of investigation and a little bit of follow-up, but there wasn't anything hugely significant for us in there. What was interesting was the way we tried to tackle it with primary pupils, though, because we were interested in having responses all the way through. So my colleague Craig Brown, who is the deputy at one of our primary schools in the catchment, he, along with some others, worked with younger pupils to do it in a more group format and have conversations and discussions about health and well-being to gauge reactions and give us responses to adapted survey questions for younger pupils, which was really helpful.
That's brilliant, Andy. Well, we're nearly out of time. I can't believe we fitted so much into that 15 minutes. That was fantastic. Great presentation and questions. So what I'm just going to direct you back, we're all back into one presentation now. You've got your link for that. And that's going to be from Judith, from another Judith from the Shine team. So we'll see you over on the next link. Okay. Thanks, Andy.